Hello and welcome to the first in a series of podcasts on epidemiology and evidence-based medicine. I'm Rashmi Patel, and in this podcast I'm going to go through an overview of what evidence-based medicine is and trying to find the best sources for evidence. For those of you who are listening through iTunes, to access the rest of this series, please visit our website at www.podmedics.com. Right, so in this podcast, I'm going to go through the principles of what evidence-based medicine is and how to formulate a question in order to answer a question based on the best medical evidence available. I'm then going to talk a bit about some of the different types of study which can be used to generate evidence, and then talk a bit about the best strategies for searching for good quality evidence. So what exactly is evidence-based medicine? Well, this definition comes from Sackett et al., published in the BMJ, that evidence-based medicine is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. So the key here is that the evidence should be relevant to the individual patient that you're looking after. And the idea is to try and find the best quality evidence which is up to date and current. And this evidence can relate to various aspects of patient care, including, and most commonly, therapy, but also prevention, etiology, the cause of illness, and diagnosis and prognosis. In addition, when considering evidence for entire populations, one aspect, of course, is cost-effectiveness of therapy or prevention. And the underlying theme of all of this is that the aim is to improve clinical care to the individual patient. Right, now, how do you go about formulating a question to answer based on the best evidence available? Well, the key is, as in the description of evidence-based medicine by Sackett et al., is that the evidence should relate to the individual patient of interest. This is extremely important because if you apply the wrong evidence to the wrong patient or population at the wrong time, this could potentially be harmful to the patient. So one way of breaking this down is to use what's known as the PICO method. And this is to consider your question in terms of four contexts. First of all, the patient, the individual patient or population you're looking at, the intervention which you're interested in, the comparator. This may be a placebo or it may be no intervention, and then the outcome you're looking at. So here's an example, which a lot of people are familiar with. Does low molecular weight heparin reduce the risk of venous thromboembolism in patients undergoing total hip replacement surgery? Now, if you were to break this down using the PICO method, first of all, you'd look at the patient or the groups of patients which you're interested in. And in this case, these are patients undergoing total hip replacement. And the intervention which you're performing is to give these patients heparin. So low molecular weight heparin would be I, intervention. Now, the comparator here could be either not to give low molecular weight heparin or to give a placebo. And the outcome which we're looking at is to see whether this reduces the risk of venous thromboembolism. So that is the O. Now, the other important aspect of applying evidence-based medicine to the individual patient is to ensure that the evidence is of good quality. The reason why this is important is a single research study only investigates the effect of an intervention on a small group of patients. But as a clinician, you are trying to transfer that information into either the entire population or the individual patient in front of you who hasn't been involved in that study. For this reason, you can never be 100% certain, no matter how good a study is, that whatever intervention which has been shown to be beneficial in that particular study group will be beneficial in the particular patient you're treating or the particular population. However, there are various methods which can be used when undertaking clinical research to try and increase the chance that the results of your research within the research population you're looking at will be applicable to patients outside of the study. In other words, the patients in the total population. There's a few concepts here which are used in clinical trials in order to increase the validity of the results. These include randomization, and by that I mean looking at when you're looking at a particular intervention and comparing it either with a placebo or no intervention, that any patients who are recruited into the study are recruited into either receiving the intervention or receiving no intervention randomly. And that will help to reduce recruitment bias into the study. Another method you can employ is blinding. And there are several levels of blinding. And blinding means that the actual intervention, whether the patient receives the intervention or the placebo or no intervention, is not known to the patient, and that's the first level of blinding. But a second level of blinding, double blinding, is that the intervention or placebo, and whether the patient receives one or the other, is not known to the investigator. And then the third level is to employ placebo control into your study to compare the intervention with a placebo. Now these are a few concepts, and I'll go into more detail in the next slide. Now, the best level of evidence which can be used to determine if an intervention is of benefit for a particular group of patients is to perform a randomized controlled trial. This involves identifying a group of patients of interest who fit the criteria for inclusion into the study, randomizing them to either receive the intervention or the control, and that could be a placebo or no intervention. And at this stage, if blinding is employed, then either the patient or both the patient and the investigator will not be aware of which group they are in. And then each patient in the study receives the intervention or no intervention or the placebo, depending on which group they're in. And then data is collected during the study on specific outcome measures. These outcome measures are compared between the two groups to see if there is a difference between the group who receive the intervention and the group who receive no intervention or the placebo. And by doing this, it is possible to ascertain whether the intervention has been of benefit, of no benefit, or indeed of any harm to this group of patients. Now, we'll go into further detail about some of these concepts in a separate podcast in the series on randomized controlled trials. Now, the next type of study I'm going to talk about is the cohort study. Whereas in randomized controlled trials, the investigator is responsible for allocating whether the patient receives the intervention or the placebo or no intervention, a cohort study is an observational study, and that means that the investigator is not responsible for determining whether the patient receives an intervention or is exposed to particular risk. A cohort study can be particularly useful in investigating the risks of developing a particular disease. Cohort studies involve identifying a group of patients with a particular characteristic, in other words, the cohort, and this group of patients are followed up over a period of time to see if there is any difference between the outcome of the two groups. So, for example, the British Doctors Study looked at a very large group of doctors from the 50s over several decades to investigate the risks of developing lung cancer and ischemic heart disease if the patient or individual was a smoker or non-smoker. So in this case, the two different cohorts would be groups of individuals who are smokers compared with groups of individuals who are non-smokers, and the outcome being investigated would be the incidence of lung cancer or ischemic heart disease. Cohort studies may be prospective or retrospective, and what I mean by that is that you could have a group of patients which you follow up over a period of time in order to see if there is any difference in the outcome, or you may already have a group of patients who have reached the outcome, and you're looking back on these group of patients, determining whether the outcome was different between the two groups. Another type of observational study is the case control study. In this kind of study, subjects are divided into two groups depending on whether they have a disease or whether they don't have a disease. So the disease is the case group, and the group which doesn't have the disease is the control group. With both of these groups, you can collect data to see if there's any difference in the exposure to risk or from a particular intervention, to see if you're more likely to have been exposed to that risk if you have the particular disease compared to if you don't have that disease. So, for example, you could take a study where patients with ischemic heart disease are compared with individuals without ischemic heart disease to see if smoking was more likely to increase their risk of having ischemic heart disease. So in this case, the group of patients with ischemic heart disease are the cases, and the group of patients without ischemic heart disease are the controls, and the risk which you're looking at is that of smoking. So the key difference between case control studies and cohort studies is that in the cohort study, the dependent variable, in other words, the one which you're measuring, is the outcome of whether the groups, the cohorts, end up with the disease or not. Whereas in case control studies, the dependent variable, in other words, the variable you're measuring, is whether the groups of patients with a disease or without the disease have been exposed to the risk. Now, there are several problems with observational studies. First of all is attrition, and that just means the number of subjects who are lost to follow-up in cohort studies. The other difficulty is that of confounding factors. Now, a confounding factor is a variable which, when analysing the data in the study, is found to correlate to the outcome being measured, but in actual fact is not causally related because of an association of the confounding factor with another variable which is unmeasured or uncontrolled. So, for example, if you were looking at a study to compare the risk of lung cancer in people who carry a lighter and compared to people who don't carry a lighter, a cigarette lighter, you might well find that if you look at people who carry a lighter, they're more at risk of developing lung cancer. But of course, the confounding factor here is that of smoking, that people who carry a cigarette lighter are far more likely to smoke. Now, so far, I've talked about individual studies, randomized controlled trials, and observational studies. One way of increasing the validity of evidence is to perform a systematic review, and that is to search and identify all of the relevant studies to answer a particular question, to critically appraise these studies, in other words, to establish the level of quality of the studies, and then pool them together and analyze them together in order to produce a systematic review of all the relevant studies to answer a particular question. And this is the gold standard of evidence-based medicine, a systematic review of randomized controlled trials, because by analyzing a large number of trials, you are most likely to identify evidence which is likely to be true when applied to the general population as a whole. And we will go into further detail about understanding and interpreting systematic reviews in another podcast. So far we have discussed different types of study, randomized controlled trials and observational studies, cohort studies and case control studies. And these different types of study can generate evidence to help answer clinical questions for individual patients. And as I alluded to earlier, the gold standard in evidence-based medicine is a systematic review of a randomized controlled trial. Other sources of evidence may include case series, and these would be either a consecutive or non-consecutive series of clinical cases of a particular disease, for example, where data is collected based on various factors, and analysed. However, because none of the data collected is from a group of patients which are compared with a control, the data from a case series is likely to have less validity than data from a randomized control trial or observational study with a control group. And then there's the last level of evidence, which is that based on expert opinion. Now, how do you go about searching for the best evidence to apply to your patients? Well, this is often quite difficult because there's an abundant source of evidence available, and it's often extremely difficult to find evidence which is both of high quality and relevant to the patient you're looking at or the question you want to answer. And as clinicians, we have several different sources of evidence. First and foremost, I guess, is our own experience based on previous cases. You might also ask your colleagues about their experience with particular cases. And then you might want to try and search different resources, and this might include things like the internet, Google or Wikipedia, or you might have a look at some books which have published information about the best way to manage particular diseases. Or you might look at clinical guidelines which are constantly updated based on the best evidence available. But ultimately, if you want to look at the most up-to-date, relevant evidence, you need to look at a peer-reviewed journal. Now, there are several ways of searching peer-reviewed journals. There are various databases available, and this is just a handful of some of the databases which you can search. So the most commonly searched databases include Medline and Embase. And Medline is probably the one which you might be most familiar with, and is run by the National Library of Medicine in the States. And this indexes over 5,000 journals, and at present has over 18 million records. Embase is run by Elsevier and also has around 5,000 journals with slightly fewer records. Another database which you might use is the Cochrane Library, and this is a database which mostly indexes systematic reviews, and so this is useful in order to search for systematic reviews of randomized controlled trials. So how do you go about searching some of these databases? Well, one way is to use a website called PubMed. And this is a freely available website which can be used to access the Medline database. What you can do using PubMed is perform a free text search of each individual record within the Medline database. In addition, Medline can also be searched using the so-called MESH terms, medical subject headings, and this is a thesaurus which provides a standardized set of keywords which can be used in order to search for particular key topics which are relevant to your particular search topic. Another very useful tool in the PubMed website is the Clinical Queries tool, and this is probably the tool you would use most often in order to identify the best evidence which is relevant to the particular patient which you are treating. So just as an example, if we were to go back to the example we used previously, looking at patients undergoing total hip replacement in order to see whether giving these patients low molecular weight heparin reduces the risk of venous thromboembolism. If you were to perform a search in PubMed Clinical Queries in order to identify relevant evidence to answer this question, you might want to search for the keywords arthroplasty, heparin, and thrombosis. Now, this is just one way of using PubMed to search for studies which are relevant to your particular question, and there are various other ways as well, using MESH terms and using various keywords and different Boolean operators like or and not. So to summarize, in this podcast we've discussed the importance of evidence-based medicine in improving clinical care and the principle of evidence-based medicine as identifying the most relevant and high-quality evidence which pertains to the particular individual patient you're looking after in order to try and identify the best and gold standard for clinical care. I've outlined a method for formulating a question to search for the most relevant evidence, and that is the PICO method. So to break down your question into the patient or population, the intervention of interest, the comparator, so that might be no intervention or a placebo, and the outcome of interest. I've also discussed an overview of the different types of study, which include randomized control trials, the observational studies, cohort studies, and case control studies, and then briefly touched on the principles of systematic review in order to identify the best randomized controlled trials, pool them together and analyze them to provide the best level of evidence to answer a question using evidence-based medicine. And then also briefly how to search using PubMed to search the Medline database to obtain evidence to answer a question. Now, we're going to go into further depth into some of these topics, in particular randomized controlled trials and systematic review, in the next series of podcasts. And for those of you who are listening on iTunes, please do visit our website, www.podmedics.com, to access the rest of these podcasts. Thank you very much for listening.